Ready to do this?
I've been waiting.
It was a journey they began together, but she is finishing apart.
Being a widow of someone who took their own life is not something I wish on anyone. Raising a son by myself who doesn't have a father, I want people to take their mental health seriously.
Mayor McHale's husband Jeremy struggled with depression and anxiety before taking his own life. They were able to seek help from a counselor, but getting expert help isn't the case for everybody.
If you don't have a doctor and you don't have access to therapy, unfortunately, that first line of defense is the emergency room.
And new statistics show that is where thousands of Canadians end up looking for help. According to the Canadian Institute for Health Information, 21,000 Canadians were admitted to hospital for self-harm between April of 2018 and March of 2019. 3,800 died by suicide in 2019, and the data found that young women and girls aged 10 to 24 were 3 times higher than young men and boys in the same age group to be hospitalized for self-harm.
It's graduating school, going into careers, figuring out your life. It's definitely a really vulnerable age range.
Sadia Faziliar reached out for help after facing her own struggles with mental health and now helps students at Ryerson University. She says getting help, especially for marginalized groups, can be challenging, and that was before the pandemic. The Canadian Mental Health Association found more Canadians are having suicidal thoughts since COVID began.
I think all of the warning signs are there that there are fairly dire outcomes, and we are actually living dire outcomes right now.
It's still incredibly difficult and lonely and isolating.
McHale says it is worrying to see the increase in people messaging her for help, but that it also means people are more willing to talk about it and look for new resources online. Susanna Da Silva, CBC News, Vancouver.